Leukemia. Good day, students. Leukemia. Leukemia is malignant tumor of the hemostatic system arising out of hematopoietic cells. Malignant disease among children. Solid tumor, CNS tumor, myeloblastosis can be acute and chronic leukemia, non-Hodgkin lymphoma, Hodgkin's lymphoma, and histiocytosis. Etiology and pathogenesis of leukemia: radiation, toxic interference of chemical substances, pollutants, drugs, and others. Viruses, chromatosis abnormalities, and prevent diseases of the hematopoietic and immune system, genetic disorders. Secondly, syndromes associated with increased risk of leukemia. What kind? Down syndrome, Fanconi anemia, Blow syndrome, Diamond-Blackfan anemia, Schwartzman-Diamond syndrome, Kostman syndrome, neurofibromatosis type 1, ataxia telangiectasia, severe combined immunity deficiency, paroxysmal nocturnal hemoglobinuria, and leaf fragmentary syndrome. Frequency of leukemia is 3.2 to 4.4 children for 100,000 children population. The highest incidence is among children 5 to 5 years of age. Boys have acute leukemia more often than girls. The frequency of chronic lymphocytes leukemia among children is 75-85. You see disruption of childhood cancer, and you see that leukemia more biggest part of this rate, 52%. In the second place is brain and spinal tumors, and the third is lymphoma and others. Let's see, more than often is leukemia. Classification. It's very old classification. It's not changed. Acute leukemia, acute lymphoblastic leukemia. This is Schiffer of United classification of illnesses. Acute myeloid leukemias. Chronic leukemia can be chronic myeloid leukemia and chronic lymphoblastic leukemia. Other chronic leukemias: higher cells, polylymphatic, and myelodysplastic syndrome. You see this once again classification for the United classification of illnesses. This is Schiffer. This is code of these illnesses in the classification. Monoclonal antibodies for diagnostics of acute leukemia. You see that for the first stage, B lymphoid CD19, cytoplasmic CD22, CD79, CD10, T lymphoid cytoplasmic CD3, CD2, CD7, for myeloid anti-MPO CD15, CD53, CD65, it's CD117, and others. For what we needed, could detect what type of acute leukemia you see in your patient. Pathogenesis. Second stadium of development, monoclonal and polyclonal. Depression of normal growth or hematopoiesis. Changing the differential cells to blast cells. Tumor cells loss enzymatic speciality transition to undifferential stadium. From changing and increasing of nucleus size, metastasis into bone marrow, and extramedullary metastasis appearing of new subclones. What's about diagnosis, laboratory and instrumental research? CB with thrombocytes, spinal tap from 2-3 points, morphological analysis, cytochemical analysis, cells immunophenotyping, cytogenetic research of a bone marrow, molecular genetic analysis, spinal fluid research, coagulogram, chest X-ray, abnormal ultrasound, ECG, heart ultrasound, and microbiological and virological research. What's about CBC duration acute leukemia? We see normochromic, normal sites, hyperregenerative anemia of different severity. Thrombocytopenia, number of leukocytes can be normal, decreased, or significantly increased. Existence of blasts, leukemic variant of absence, leukemic variant, and leukemic collapse, absence of transitional forms between blasts and mature cell. What's the biochemical picture? Hyperplastic syndrome, lymphadenopathy regional and generalized, hyperplasia of amygdala, dense and ours, infiltration of leukemic cells into derma in the form of red blood papilloid flacules, hepatosplenomegalia, more in case of acute lymphoblastic leukemia, renal lesion, hematuria, arterial hypertension, renal insufficiency, eyes lesion, heart and lungs lesions, and lesions of bone tissue. So you see that a lot of organs are destroyed. So that means that clinical picture clinical manifestation can begin from each of these syndromes. And we can see the masks of resilience. What's about CNS lesions? Nearly causes. Central nervous system is destroyed for that means. Anemical syndrome, palanas, systolic murmurs, tachycardia, dizziness at hemorrhagic syndrome, parental muscular type, bleeding, nasal bleeding, and others. They are when leucos we can confused with the clinical be confused with the clinical pictures, and you can think that it's another diseases, as like as SARS, rheumatoid arthritis, thrombocytopenia, and asymptomatic leukemias. Sometimes they can have tonsillitis, they can have arrhythmias and other syndromes, but you should be careful. Specific of a congenital leukemia among children. Expressed hyperplastic process, swollen peripheral lymph nodes from the size of bean to the size of pigeon egg, elastic. Tumor of the mediastinum. Increasing of intrathoracic lymph nodes. Leukemic infiltration of the thyroid. Several tissue of the mediastinum causing dyspnea, rectus pain, and others. Increasing of liver and spleen, more than 2 to 5 cm soft, painless, smooth. Stadium of acute leukemia. Inception phase, manifestation, full remission, and it can be recovery, full remission for 5 years, relapse, residual leukemia population of cells run out of therapy control, as a result, return of the leukemic process, and the terminal stage, process of leukosis, full exhaustions of the normal chemopoiesis. Risk groups. Standard risk group is initial leukosis less than 15,000 microliter, no intestinal lesions of central nervous system, spleen size is less than 4 cm, no pre-QT immunology, remission for 2 to 56 days of therapy, no translocation organs. The second, intermediate risk group. Initial leukocytosis more than 15,000, initial central nervous system lesions, spleen size more than 4 cm, pre-QT immunology. And the third group, high risk group. We see initial leukocytosis 100,000 over microliter and more during B immunology. Remission absence to the 36 days of treatment. And you see translocation for these chromosomes. What's about replaces the painful localization and spreading? Isolated. Spinal, more than 5% of blasts in bone marrow or processing increasing of the blast from the 5% to 25% during 1 and more weeks. So that means you take it by bone marrow to the test and you see the blast cells. If the number are increased, you see these changes. Neuroleukemia. Neuroleukemia means extramedullary infiltration of central nervous system. You take spinal fluid and you see blood cells. Blood cells, it's a young blood cells, blasts, young leukocytes. Testicular, you see leukemic infiltration in testicles, less than 5% of blast in the spinal fluid. What's about combinate? Spinal plus neuroleukemia, spinal plus testicle, spinal plus neuroleukemia and testicle. It can be two, unfortunately, and relapsed depending on time of appearance. You see early and late. What's about differential diagnosis? You should differentiate acute lymphotic leukemia and acute myeloid leukemia. You can write this information. I will wait with you. Conventional leukemias. I can see 0.3 to 100,000 of newborn. Miscarriages, stillbirth, anemia, hemorrhagic syndrome, hepatosplenomegaly, increasing of lymph nodes, leukemic infiltration of skin and organs, and hyperleukocytosis. Basic principles of a treatment. Identification of prognosis factors. You should understand what's happening in the patient. What does it mean? Identification of prognostic factors. Let's back to the this slide. To the risk group. What's happened? Standard risk group, intermediate, or high risk group. What will happen to your patient? So you choose for the laboratory tests, what for the changes of central nervous system and the genetic chromosomes, what will happen. You understand this? Okay. The next step, dividing the sick people to the risk groups. You should understand for a first point to the second point. Development of differential problems of therapy, because we should understand what kind of leukemia and what kind of group you should to have the correct therapy. Organization of the multicentral research and cooperative clinical groups. Intensive initial polychemotherapy and developing for research in pharmacokinetics of different cytostatics. Developing of according therapy, prophylaxis of neuroleukemia and bone marrow transplantation too. Basic principles. Induction of remissions. Multi-ages consolidation of remission. Maintenance therapy. Prophylaxis and treatment of neuroleukemia and reinduction. Return to short concepts of induction. You should see diagnostics of acute leukemia is not verified without spinal puncture and cytological research of spinal fluid. You should do these two laboratory tests of spinal cord and spinal fluid and spinal bone cord. Corticoids cannot be used before the verification of diagnostics. Why? Because makes diagnostics more difficult and masks the clinic. will mask clinical signs and decreases the effect of the prevention treatment. What's about chronic myeloid leukemia? Chronic myeloid leukemia is a tumor of hematopoietic tissue as a result of transformation of stem cells of predecessor of myelopoietic cells. 5 place in morbidity structure among adults. What's about genesis of chronic myeloid leukemia? Clone nature of tumor. It's localized in gene T922 chromosome Q338, 34 Q11 among 90% of patients. Numerical oncogenesis BCR-ABA. Philadelphia chromosomes we see in the genetic tests, Philadelphia chromosome, and we see 2 stages of development, monoclonal and polyclonal, blast crisis. What classification? Variants: pH positive, pH negative, juvenile, and stages: chronic, acceleration, and blast crisis. Diagnostic criteria of chronic myeloid leukemia. Chronic stage is the latest splenomegaly in peripheral blood, leukocytes, moment 20, with the left shift. In bone marrow, we see myelokaryocytosis and blasts and neutrophils. Trifana biopsy. Hyperplasia growth, granulocyte growth. Stage of acceleration. Peripheral blood, leukocytes double in 5 days interval. Refractory anemia, thrombocytes and thrombocytopenia blast cells. Bone marrow, blast moment 10%, eosinophilia and basophilia. Trefana biopsy, myelofibrosis. The clinical of blast crisis compliance with the clinical of acute leukemia. Laboratory and intrametal research of chronic neuroblast leukosis. CBC, biochemistry, bone marrow, Trifana biopsy, cytogenetic tests, molecular biology, cytochemistry, electrocardiography, and heart ultrasound, abdominal ultrasound, check X-ray, spinal fluid, and urinary test. What kind of variants of therapy? Interferon of monochemotherapy, myelosanal or hydroxyurea, combination treatment, bone marrow transplantation, radiotherapy, and полихемитерапия, цитозар и мелобранол. Oncogen activity inhibitor, BCR, ABL, imetidine. Thank you for your attention.